Welcome to this afternoon's webinar, which is covering the management referral process and also the pre-placement questionnaire process using the G2 software. In this session, we're going to show you how you can send in management referrals and show you how you can communicate with clarity, and throughout the process, tracking the progress of your referrals right through to receiving your report. And on the pre-placement side of things, we're going to show you how you can send an email request to your new employees for them to complete their questionnaire online, and show you how you can get that and track the progress of that questionnaire being assessed and certificated. Now, for those of you that have been using Cohort with Clarity to control this in the past, I'm hoping that when you actually look at the system, hopefully you're going to see that whilst you're actually looking at a different screen, it might look different and have a different feel. All the processes in the system are actually exactly the same. So hopefully, as well as simplifying the area, certain areas of the system, we will be able to also, we've also added a couple of key additional improvements as well. So hopefully there's a couple of areas that will benefit you from the last system. Now, just before we go into the system itself, I just want to cover a question which quite a few people have asked regarding how referrals and questionnaires are going to be dealt with that were actually set up in the Cohort system and are still actually open. Now, anything that was actually set up within the Cohort system will be coming over to the OPAS system. But in order for us to, the way in which we migrate all the information over from one to the other, it's a two-stage process. And so to ensure that we've got a working system at all times for people, some of the actual information will only be coming available in the next 2 to 3 weeks. So anything that is currently open or not been completed, Clarity have got all the information and are going to be continuing to work on them. And really there's two options that will allow you to see straight away those details of that on the system. And I'll go into that at the end of this session, but I just wanted to point that out, that at the start, when you log in for the first time, it might look like that nothing's there. The information will be coming over, but obviously until the actual data gets migrated completely, you might not be able to see those to begin with. So I'm going to now change the screen. That I think you should be able to see now my OPAS logon page. If we log on to the system, when I log on today, whilst I'm doing this, I think it's important to actually just mention that what we have actually done is we've listened to a couple of things from our existing customers, and what we've done is we've tried to improve the way in which people can log on, so it's a little bit more of a robust system when it comes round to changing and resetting passwords. So you will hopefully see a little bit of an improvement within that process. So I'm going to log on to the system now, and when you land into the system, you're going to see a home page which looks very similar to what I've got on my screen. Now, just to sort of talk you through this area, the main navigation menu is down the left-hand side of the screen. So this is where you'll be able to enter the areas that you have permission to. So today we're going to be dealing with the management referral process and the pre-placement process that you can see down at the bottom on the left. And from the actual, the main part of the home page, you're going to see on there, there's a couple of quick access points, so you can get to the particular areas in in quick fashion. You can see that probably the most standout one there is I've got a pie chart there currently, which is showing information on all the pre-placement questionnaires that I have currently on the system. Now that information is actually being shown in a pie chart, and it's filtering everything by where these questionnaires are up to. So it's at what stage of the process each questionnaire is set up to. So what this is demonstrating is that you're going to hopefully be able to get a little bit more management information from the system based on the questionnaires and the work that's going on in the system. Just to the right of that, you'll see I've got an area where it's listed active pre-placement. So this, again, it's a quick way of clicking on any specific questionnaires that are currently in progress. And if there's a little see more button there, and it will take you through to the actual pre-placement section. Underneath that, we've got the same type of quick area, but instead of it being pre-placement, we've got the management referral cases that are open. You can see there's a big green button there which is saying open, and that is how you can open those specific cases. Up on the top row of the home page, you've got a quick search area. Now, if you do want to just search by an individual that you know you've set up, you can quickly get to that information through the quick search button. And then probably on the right hand side, you can see there in the top right corner, there's a little icon which is it's in the form of some speech bubbles, and I've got a number 12 there. That is where you will be able to quickly reach all the notifications that have been sent you based on the work that's been created in your area. So this area, if you click on the bubble, you can get to all the notifications that have come in, and you can set the notification list there to show all the referrals that haven't been read yet, or you can also include the ones that have been read. Now, all the notifications that do come in, so just like in cohort, every time Clarity makes any change or update to the system, you're going to get a notification to tell you. And every time it lands in your system, this is a place where you can quickly access it, but the actual notifications will still sit within the particular referral itself. And I'll show you where you can pick them up from later on. All right, so I'm going to start off by looking at the management referral side. If we click on the management referral option in the navigation menu, just like the cohort system, you've got a dashboard, but it does look a little bit different here. Now, this is one feature which has been added, and instead of just having a list of all your live and open referrals, what it's done is it's splitting down your list of referrals by the stage in which it's at in the process of completion. So you can see the top of my list will be listed all the ones that have just been completed since I've last logged on. And so you can see I've just in the meantime had a referral for Paul Garner that's been completed. If I wanted to, I could click into that particular referral, clicking the open button on the side. But if I just scroll down a little bit further, you can see that there's referrals at different stages of the process there. So you can see the ones awaiting for OH triage. They're the ones that you've sent into Clarity, but Clarity haven't done anything with it. You can see the ones that are currently being worked on at the moment, so they're in progress. And a little bit further down, there's a few different levels there. So it would show you if the referrals that are actually sitting waiting for an employee, for instance, to give their consent to release the report. So this hopefully will help you understand where you're up to with these referrals in a little bit of easier fashion. And so the best way to show you how it works again is to create a new one, and you've got a big button in the top right corner where it says create. And if I click on that button there, this is probably the place where you will notice the biggest change. And the change itself hopefully is for the better. So instead of having 3 different pages to completing a referral form, it's all in one form, and hopefully it's basically the same questions and the same fields, just laid out slightly differently. You can see at the top of our form there, it's actually inputted the details of the person who's filling this in. So you, as the referring manager, your details will show at the top of the referral form. You do have the option, let's just say you change your phone number or your email address, you can update these details yourself now by clicking on the update button, and that allows you to provide different information there. Now, the biggest change on this system, and we've taken this, having spoken to the data protection authorities, and also some of our customers have been asking for the system to be set up slightly different. In the past, we've had to use what we call the HR user system to allow other people to also have access to this referral. Now, whereas in Cohort, you could specify that one other person has read-only access to a referral, now in this system, it does allow you to add as many additional contributors to the referral as you wish. The only stipulation that there is now is that this person has to still be an active or a user of the OPAS system. So they have to have their own logon to the system. And so long as they've got that logon, you can add them as an additional contributor. And that allows them to see everything on a referral, but it also will be, allow them to add their own input to a referral as well. Okay, so that I think will certainly benefit some companies, because it takes away the need to have that HR user system. Now, when it comes down to the actual referral details itself, you can add the details of any line manager of the individual, and we can add obviously the details of the individual that needs the referral themselves. So while I'm filling this in, what you will notice is a difference from Cohort is, instead of you having to search for the individual on the system to begin with, Clarity are going to take the responsibility for doing that and the matching process ourselves. So it makes your job a little bit easier. So we will make sure that this matches up with the people that are already on the system. So you'll just need to type the name, the date of birth, and I'll quickly do this as we're going along. A job title, and it'll allow you then to choose where in your organization this person is going to be working. So it will allow you to choose from your company structure. You just go down the drop down and pick the location itself. And then I'm going to add some details here for this individual. You can add the address if you need to, and then there's also an area where you can add the reason for the referral. So just like in Cohort, it's like frequent short-term absence, long-term sickness absence. There is an option in here. Now, in Cohort, we were specifying whether it was an occupational health advisor referral or an occupational health physician referral. If you require a physician referral, it's an option in this list here, the reason for the referral. So you can choose the occupational health physician option in this list. And then it brings up the questions that you need to complete in the referral form. So it will allow you to provide some details about the issue in hand, if there's any background information that we need to know about, what if any has the company done already on this case? You know, has there been any actions already? And also you can highlight what you're actually looking for out of this appointment. So we can, once we've added some details about the case in itself, you've got the referral form there. When we move on to some information about how this referral appointment is going to be booked. So would you like this to be face-to-face, telephone-based, or a video call? How would you like Clarity to try and book the appointment? Would you like them to go directly to the employee? Would you like them to speak to yourself as the referring manager to arrange things, or would you like them to go through an additional contributor? And you can provide the details there of who needs to be completing that process. Okay, so you'll also, again, have the ability to ask to have a pre-case and a post-case conference. So that's exactly the same as in the past. And then you've got an area now where we've mentioned the issue in hand, but you can provide some details about the job that the individual does and how it might relate to the case. So just like you used to be able to do, you can add supporting documents at the end if you wish. So if you have job descriptions or things like that, you know, it might be a list of tools that someone uses. You'll be able to attach documents just the same, and you'll be able then to, as once you've added the details on the job, you'll also be able to add a few little notes on the environment that the individual might be working in. So, for instance, they might be in a noisy environment or working around hazardous substances, or whichever might be relevant to your referral. One extra bit which wasn't on the existing referral form, there's a little bit of information you can add about current absence. So if the person's off at the moment, you can provide how long they've been off for, you know, when did the absence start, etc., and what the reason for the absence was, whether it's work related or whether it's not relating to the job itself. And finally, you've got that option there to just choose from any of these questions that are listed, just to make sure that the advisor will cover the answers to these questions within the report at the end of the process. Now, there are going to be some questions that you may wish to add to this. They might be very specific to this particular referral. And so by clicking add additional question, you'll be able to make sure that you get to the bottom of that particular question within the report as well. So hopefully still maintaining that ability to try and make sure the report's going to be useful as possible. Finally, the area in the documents section is where you can attach your sick notes and your GP letters and your job descriptions. Just click browse for files and it'll let you search your computer to find the document you need to attach and click open, and you can drag and drop as well, and it will pop the document onto the referral. Okay, so once we've filled everything in, we can just complete the declaration. It won't allow you to send this in until the 3 questions are answered by a yes. And to send it into Clarity, you just click submit to OH. By clicking if I've just clicked on submit to OH, but you can see I left out an answer there. If there is a question or a field that you've missed, then it always takes you back to that particular field to make sure that you can fill it in. So any mandatory fields there that you need to fill in can be done so in this, you know, before you send it into Clarity. So I'm going to click submit to OH. So I missed a couple more there. So add a purchase order number there. If you haven't got a purchase order number, not applicable, will allow you to move on as well. Okay, so I'm going to confirm that I want to submit, and we're going to get a message coming up now telling us that the management referral has been saved, and we've also sent the referral into Clarity Healthcare. You're going to get a notification via email just to confirm that has been done as well. So I'm going to continue, and it will take us back to our dashboard, and you can see under awaiting OH triage now, I've got a new referral that I've just set up at the bottom there for Joe Blogs. Okay, so once everything's been set up, if I open up a particular referral, I can click on the open button. So if I open up the one for Paul Garner here, once we've opened the referral itself will be laid out in this sort of format. So you have the details of the actual referral form that you sent in over on the left hand side. If I just scroll down, you can actually close some areas of it down as well, and to try and make it a bit easier to find things. But so you can click open and close them when you're finished with them. So it's got the details of yourself, the details of any line managers there, and it's got all the questions that you filled in on the form, and you can see all those details there. And then right down at the bottom, once we get to, I'm going to open up a different one because that's in progress and nothing's happened on it. But if I open up the one that has actually been completed today, if I click open, you can see at the bottom of the form, once things have been completed, you can see the answer. The OH advice section is where it will outline any of the specific questions you've asked the advisor to complete. And if we scroll down, you'll have your report listed in there as well. You'll have an outcome as well. So any specific outcome and any adjustments that have been recommended will all be in this area as well. Over on the right hand side of the screen, throughout the referral, there's an additional information section, and within these three particular tabs, we've got referral activity. This tab is where you will see a step-by-step history of what's happened on this referral. So each time a step has been completed, it will be listed on this section. If you wanted to send Clarity a message at any time, click on the send message button. And one added addition to this, you can see there it asks, would you like to send this message to the OH department? And the OH department is Clarity. Okay, so you can click yes or no, or you do have the option to send the message to the additional contributors rather than Clarity. Type your message, click send, and that message will then be added to the referral activities. The document section is where any documents that are connected to the referral will be listed. So it'll be where you will see any documents you attached at the time of submission. You'll also be able to come in here and add things to a referral throughout the process by just clicking add attachment. And finally, at the end of the process as well, you've got the communications section, and it will list any emails or letters that have been sent throughout the process between yourself and Clarity. And at the end of the process, you can see there, management referral, OH completed to referrer. You'll be able to click on the communication as well and pick up a copy of the referral form, of the referral report. Okay, so that's how you sort of maneuver around a referral. When notifications come in on a referral, I mentioned before, they do land in the notification section at the top of the screen. But once the notification comes in on a referral, it will sit within the referral activity section as well. Okay, so it is actually attached to the particular referral. Once, if a question's being asked on one of these, you'll be able to reply to that message as well. So hopefully, when you're looking at the screen itself, everything that you could do within Cohort, you can do in OPAS. It's really just more of a fresher, more different look of the screen of how it's being displayed. Okay, now throughout this webinar, by the way, if you do have any questions as we're going along, please feel free to add questions into the chat or into the Q&A section. We will be picking these questions up after this webinar, and we will answer all these questions after this, and we'll put together a frequently asked questions package as well for you. So please feel free to ask any questions. I'm going to move now on to the pre-placement section. If I click on the pre-placement from the navigation menu there, it takes us again to the dashboard that relates to the new starter questionnaires. Again, it's listing the questionnaires that are live on the system for me, and it filters it by the stage in the process that these questionnaires are up to. You will be able to, basically the system is exactly the same. We're going to be sending, filling a short form in to ask for an email to be sent to our new employee, and they will receive a link to the system, which will land on the questionnaire itself that the individual needs to complete and submit to Clarity. Now, again, it's worth pointing out the way in which an employee logs onto the system has been slightly improved. So instead of having verification codes and things like that to include when logging on, there is simply a secure link via an email to the individual, and they will literally get in straight to the specific questionnaire straight from the questionnaire itself. So hopefully that will negate any of the issues that has taken place in the past when people have been trying to fill their questionnaire in. Okay, so again, if I show you how you can set up a new questionnaire, we click create in the top right corner. All we need to do is need to add the new employee's name again, as we did in the other system. So we type first name, last name, and their email address into the system. And we can then add the details of what job they're going to have. So we put the job title into the system, a proposed start date or when they started or going to start. The shift type field is not mandatory, but if you want to complete it, you can. And again, you've got the employment location option so that you can choose where within your company this person's going to be working. So from here, that is the mandatory fields completed. You could, if you wish, click issue to applicant now, but we have added a couple of extra sections which are quite beneficial for you. If you can fill it in, it really does assist our advisors. Firstly, in the assessing of the questionnaire itself, but also later on down the line when people come to have their health surveillance carried out, it will become a little bit more useful as well. And you can see there's a few questions about the actual job itself and the tasks that they do. So will they be doing lots of driving or regular night work, or is it flexible working hours? Or there's some questions about driving, any handling food, that type of thing as well. Feel free to tick anything that is suitable and relevant to this particular person's role. And a little bit further down, there's some questions about the environment they'll be working in. So will they be working in particularly dusty environments or noisy environments? All this helps in the long run to create a more of an idea of what this potential employee is going to be working in. So click issue to applicant, and again I'm going to click submit, and the email is sent out to our new employee with that link for them to log on and complete their form, just like in the cohort system. By clicking continue, it takes us back to our dashboard, and then if I scroll down, you can see again it's listed to the different stages in the process. And if I scroll down to issued to applicant, at the bottom of this list, you'll see I've just created one for Joe Bloggs there. Once the whole process has been completed and it's been assessed by Clarity, and there will be a certificate on the system to pick up, and if I scroll up to the top, you can see, I think there should be one completed, or has someone taken it out? Yeah, someone's actually used my example up and used it already. But what you would do, you would click on open in that particular questionnaire, and once it's been completed, in the communications section you will have received a message telling you that the questionnaire has been assessed and certificated. You'll be able to, there'll be a message in this list, and in the green area there'll be, instead of it saying resend, it will say download. You click on the download button and the certificate will be there to be, it will create a PDF copy of the certificate just like you had before. Okay, now again, just in the system, it's worth pointing out, if I go back to the pre-placement dashboard, if your individual doesn't complete their questionnaire in a timely fashion, again, you can go into that person's questionnaire, open it up, and you can see there's a reissue to applicant option at the top there. And if I click on that, it resends the email to the individual. Okay, so hopefully again you'll see the system itself exactly the same as within cohort. So hopefully you'll see that's how to use the referrals and the pre-placement sections there. Over the coming weeks, you can see there's a surveillance program section there for those of companies that do have health surveillance carried out. Probably within the next 3 or 4 months or so, over the next quarter of the year, we're going to be introducing a few little extras so that you'll be able to get a little bit closer to your health surveillance appointments and get information via this system for those as well. So there are some benefits coming in on the system over the coming weeks. Bear that in mind as we start using the system. If you do need any further assistance on what I've talked about this morning or this afternoon, please ask any questions you do have in the chat. Feel free as well to email the tech support Clarity email. So that is techsupport@clarityochealth.co.uk, and we will be able to go through any questions you might have on the system, and if you need any further help and assistance. If I just confirm as well, if I just touch again on the open referrals that have been set up in cohort already, Clarity will be obviously getting in touch with you on those specific referrals. We have all the information. We're still working on those as normal, but it's just outside of the system at the moment. One thing which you can do if you want to wait for the 2 to 3 weeks for it to be showing on the dashboard, then that's absolutely fine. The other option is if you contact us, we can send you a copy of the referral form that was sent into the cohort system. If you did want to resubmit it through the OPAS system, we would then be able to add the all the updates within the system for you. Okay, so hopefully you found that all useful today, and please get in touch if you do have any further questions or you require any further assistance. So thank you for your time, and I'll speak to you all soon.